Hi, everyone. I just wanted to welcome everybody to our special Facebook Live event. We have Dr. Andrew Valleroy here, and we're super excited to have him. Really appreciate him taking the time out of his busy schedule for this. So, here in a moment, we're going to touch base on a few different things, just different insights that he can bring to the table. Hopefully, you guys will learn a lot of information about additional options that you have as far as your healthcare needs. So, just a little bit about him. I'm going to read off this so I make sure I don't get anything wrong. So he is one of our very distinguished family physicians within that area. He has a rich background and is passionate for comprehensive primary care. He's originally from Hillsborough, Missouri. He has honed his skills at Southeast Missouri State University before he advanced to medical school and a family medicine residency at University of Missouri Columbia. So there he served as chief resident, but he also developed a keen interest in sports medicine and concussion care. And he's helping out with his daughter's softball team. He's coaching, and so he's bringing those into his personal life as well. He's committed to providing a medical home for his patients, helping them navigate the complexities of our unfortunate healthcare system, and in some ways, really advanced healthcare system. He's addressing athletic and musculoskeletal issues across all ages. Outside of his professional life, he enjoys spending time with his family, including his wife, Andrea Schuster. She is also a family physician. They have their two children, and they're currently expecting another one. He's an avid outdoorsman. He loves fishing, hunting, coaching, softball, and contributing to his community. So we welcome you. Thank you so very much. Again, I appreciate you taking your time out of your day for this. So I just have a few questions. We'll open the floor for any kind of comments. If anybody has any, feel free to comment in there, and we'll try to address those as they come through. So, Dr. Valleroy, can you tell us about your approach to managing common conditions like knee pain, low back pain, and neuropathy, just in general in your practice?
Yeah, thank you very much for the intro and for having me. We see as family docs, we see all ages of patients, and naturally that would be the first approach to a joint problem or a musculoskeletal problem is what's the age of the patient, and then that's followed to me by what's their activity level. So is this somebody who has a chronic issue that is from injuries younger in their life and perhaps they're just having to deal with them day to day at work? Is this, a marathon runner who's needing to get through a race? Is this a young athlete who I need to protect and keep them safe from future injury? So I think, it all starts with what's the lens through which we're seeing them. At what stage of life and at what competition level are they, and then we kind of hone in on what is going on with their pain, what have they done so far, and then I really do try to get pretty clear pretty quick of what their expectations are of how things should go. I think it's helpful to know what people have heard about or talked to family about or seen online, and you know how that can be very good or very not so good. And so, what are they expecting? Do they think this is going to be a quick fix? Do they think it's going to be there's no hope, and I'm just going to be another person telling them there's nothing we can do? And then I kind of dive into that and set up, what I think is a by the evidence treatment plan that fits the patient's needs. And that would include, where they can go, where they can travel to. Do they want to see the world's most expert in knee pain and they'll go to, a university across the country, or do they need to stay local? Do they have a fear of procedures or surgery? So I think it's really key just to set up an individualized approach that takes all those things together, and then we kind of put together here's your plan at how I can get you better or how you're going to have the best chance to get better. And then we take it step by step. And I think the other key piece is that, you're not going to fix much in one visit. And so it's important to have, those follow-up appointments to see how things are going. And do we need to change the plan? So that's kind of a nutshell for a lot of different things.
Yeah, and I mean, that's very comprehensive. I love that you do those individualized plans for you, because you got to meet people where they are. Not everybody wants to run a marathon. Some people just want to be able to walk around a grocery store. And so I think that's absolutely accurate. And I love also that you're thinking of things in the future for them. Sometimes our kids in these young sports, and you've got kids in sports, I've got kids in sports, and you see the demand that put on them, and just to be that advocate for what they potentially need for the future too. So I love that. Thank you for doing that.
Sure.
Okay, so what are some of the challenges that you've encountered with patients experiencing these types of conditions, and how do you particularly address them?
Yeah, so challenges I think are many. I think a lot of times people have, with painful joint conditions or musculoskeletal conditions, people are typically dealing with daily dysfunction or pain, and that's causing them a problem most of the time. If they're seeing me or they're seeing you, they're having problem more than just a little bit. And so, they're usually hurting to some degree. They're usually frustrated. They may or may not have been to X, Y, or Z doctors or urgent cares. And so by the time we set up this plan, sometimes people feel like the deck is stacked against them. So sometimes you have to kind of roll with that and try to help them know that there are some other options and that we're going to kind of go down that road. The other challenges I think are, there's stigma to chronic pain. I think that some people feel that they're going to be judged immediately if they come in and tell me they have low back pain or they have chronic knee pain, that they almost don't want to tell me that because of stigma that our society has placed upon that. And I think it's important to, point out that, while, we treat pain differently than we did 10 years ago, that doesn't mean that we ignore chronic pain or chronic injuries or things like that. And so I think letting them know that, we're not anti seeing people with chronic musculoskeletal injuries. I think the other challenge that may be more of a problem in certain areas as opposed to others is that, we have a lot of manual labor jobs in our area, whether it's factory or whether it's farming or whether it's construction. So a lot of these people are needing a treatment plan that fits within the confines of a job that is probably exacerbating their condition. And so how can I, right. And so how can I, and you do this more than I do, I'm certain, of how can we help you work without harming what we're trying to do, but also not remove you from work so that you can make a living. So I think that's a big one that becomes very challenging at times when it comes to people's livelihood. So.
Absolutely. It is definitely a fine line that you have to walk, right? Because these, individuals who come in, including individuals in my family, things of that nature, there's time constraints on their particular jobs too, that they don't really have time to be down. They don't have time to not feel well. And so the idea that what can get me the best, the quickest in some regards. But like you mentioned when we first talked, we still got to look at this from a long-term standpoint too, right? So we can try to get you these initial advancements as quick as we possibly can, but we have to make those alterations and changes to your daily activity. Okay, so how do you integrate chiropractic care into your treatment plans for patients or musculoskeletal issues? At what point do you feel like they would benefit from that?
Yeah, so it depends a little bit on what the nature of the condition is. If taking out acutely traumatic injuries that are kind of obvious of what to do. If you tear an ACL, no matter what you do or I do, we're not going to heal that without something. So I think, filtering out what injuries is there a good basis of evidence for chiropractic or manipulative therapy, and then taking that in concert with what the patient's kind of expectations and attitude is towards that. So I kind of introduce it pretty early for most of this. And my approach is usually that for a lot of these conditions, when I think of, chronic knee pain or neuropathy or chronic low back, even chronic neck pain, a lot of these people are stuck in this limbo of they've kind of tried the textbook medical things like medications and physical therapy, and maybe they've had a shot in their neck at some point or their back, and then they're kind of like, well, what else is there? And so that's where I kind of try to get down to them and say, well, yes, there's not huge randomized clinical trials for X, Y, or Z chiropractic therapy necessarily, but what are our alternatives, and if we can get the pain better without having to go through surgery or procedures or using medications that have lots of side effects, why wouldn't we? So I usually try to engage them pretty early to say, have you considered manipulation as an adjunct, and just set that expectation of, if you do this and you see benefit, awesome. If you do it and you get worse, okay, we can always pull back and say, what's best. And so, I don't ever want anybody to feel that I'm saying, go see, Dr. Brunjes and I'll see you next year. I hope it goes well. It's, I want you to go see them. I want to get their opinion. I want you to do some sessions, and then let's see you back and revamp your individualized plan and see what's working, what not. It's no different than if I say, try this anti-inflammatory medication, if it helps, okay, we're on the right track. If it doesn't, okay, are we targeting the wrong thing? And I treat chiropractic care very similar. Also, a lot of times, whether I'm sending somebody to a chiropractic or they're seeing a chiropractor or a physical therapist, that's another medical professional that's laying eyes on the patient, examining the patient, and giving me information that I may not have, either through my training, I'm not approaching it the same way, or it's just something I've overlooked. And so it's really helpful to have another professional's opinion of what's going on and what could be done for that. So
yeah, and that's kind of how like we were taught in school too. We're looking at the same patient, but because of our difference in trainings, like we're looking at them in different views. So I love that comprehensive approach of the idea that all encompassing, the more that we can all work together, the better outcomes end up coming from the patient. I always use the example, it's like you're looking at my hand, right? Well, my hand's somewhere on this camera. Here we go. So it's like you're looking at this part and you see my palm and you see the lines of my hand, whereas myself, I'm looking at the nails. Like we're seeing the same person, we're just looking at it from different sides. So the idea that we can collectively come together for what's best for the patient, I think that is always the best approach. So, okay, in your experience, what benefits have patients noticed from combining both primary care as well as chiropractic treatments?
Yeah, I think I've had a fair amount of success for my patients when they incorporate chiropractic care in. And that runs the gamut of people who, I see them and they say, well, with the combination of the physical therapy exercises you gave me and the medication I took for 2 weeks and my periodic adjustments, I'm doing great. I'm a little sore, but I'm doing great. To sometimes I see people, I say, hey, let's try some chiropractic care, and I don't see them again for a year, and they say, oh yeah, I've got that managed. I go once a month and they're taking care of me and it's doing great. Thank you. And so it kind of runs the gamut, but I've seen a lot of benefit. I think it's another tool in our toolkit for chronic or acute musculoskeletal injuries. And I enjoy that kind of collaborative practice. And I think patients too appreciate when they're given a recommendation or a referral from their primary care doctor of somebody that they know and trust, versus just saying, oh, hey, hit the yellow pages and find somebody and see what happens. If I know the people and I know that they're competent and professional and kind, I think that goes above and beyond, and patients can recognize that we're looking out for their best interests. So, I think I've had largely almost all positive when we incorporate that in. And I think patients, sometimes certain patients are fearful that there's this turf battle between medically and chiropractic trained and physical therapists. And it's really nice for me to just be like, That may exist somewhere still, I'm not sure, but in this office, it doesn't, as long as, everything's being done by somebody who knows what they're doing. We're all in on these things. And, if I had all the answers to fix everything without other avenues, I wouldn't need anybody else to help me take care of you, but that's just not reality. So I think they get a little bit of a breath of, oh, okay, this guy is not going to judge me if I'm going to go ask my chiropractor their opinion before I talk to him or something to that nature.
Right.
And so I think once they know that we're open to that, I think that helps too.
Absolutely. Well, and it's like you said, unfortunately, chiropractic isn't a good fit for everybody, right? There's different circumstances as to why certain adjustments are not safe for certain individuals. And
Right.
So the idea that you're finding somebody that you trust, or even just like from their own personal experience too, like you hear different things. We have so many fabulous chiropractors in our area. We're super fortunate that there's a lot of opportunities for people to see a really great chiropractor. And so I just, that's just important to know that not everybody is a good fit for chiropractic care, and to have a chiropractor that can recognize and point those things out, and to have different avenues, just like you would like different avenues to recommend patients to go see, right? So sometimes it is, hey, we need to do an MRI. This is not looking really great, or hey, this is a surgical case, or however that looks. So I think it's nice for individuals to recognize and realize that that's across all healthcare fields, or it should be anyways, right? That you have different avenues, because we can't fix everything. Not everybody, not one individual person could fix everything that needs to be. Right. So I love that. Okay, given your interest in sports medicine, how do you approach injury prevention and management in athletes and active individuals?
Yeah, so very good question. I'm a big proponent that, basic kind of tenets of athletics. So basically, I tell people, don't go from the couch to a half marathon. So gradually enhancing your movements and your activity levels, I think is paramount. And then I really get harping on overuse, especially in younger people or in my runners. Just having to be not mindful of chronic overuse injuries. There's this mindset that's probably ingrained in us very young, that you should play through injuries and it'll get better, and you just push through it and be this kind of toughness. And to some degree, that's sometimes the case, but with chronic overuse injuries, a lot of times we need to modify what we're doing. And so I try to help people find other ways to keep their core strong, to keep their muscle tone up, and to keep their cardiovascular fitness up, that may not be exacerbating their injury. So sometimes that's for them to get out of their comfort zone, to switch the type of exercise they're doing, to focus more on core, or whether that's doing some yoga or swimming instead of pounding the pavement, or those sorts of things. So sometimes it's a real challenge to try to find that, but I enjoy that piece of it too. And a lot of times, if people are resistant to that, we just say okay, but then when they're not better in a few months, then we can have that conversation again, and usually then it's kind of a I told you so nicely.
Yeah, a little more receptive to it.
Change something because what we're doing is not working. So try to meet them where they are and help me understand what their goal is. Are they just trying to get through a race and then they don't plan on running again for 6 months, or is this a lifelong hobby or exercise that they want to continue to do? And that kind of, again, gets to, okay, how can we keep you running long term, or keep you doing the activities you want to do? So
yeah, absolutely. And I think any of those, like you said, meet the patient where they are, but then make sure they recognize that, hey, maybe you don't know that this is maybe what's best for you, and eventually they start to kind of figure that out.
Yeah.
How does your concept of a medical home influence the way that you care for patients with chronic pain and recurrent injuries?
Yeah. So, the old new idea of the medical home is something that myself and my partners here in our clinic, really kind of make our cornerstone of what we do. That we want to be actively involved in our patients' care. We want to be in the loop, and we want to make sure that you're getting the best needed care at the right time and at the right place. And the flip side of that is also at the right cost. So our health system has, a big expenditure, and we try to help people navigate that because we think that's important and often overlooked, that of what people can afford, because healthcare is not cheap. So I think it's kind of a combination of all those things. And I think it also is helpful to have us be the center point, where then we can say, okay, I want you to go see Dr. Brunjes and come back and we'll chat, or I want you to go see this orthopedic specialist, or I'm going to order this MRI and I'm going to decide what to do, to try to avoid people from seeing too many, as we kind of say, too many cooks in the kitchen, to where they're getting told different things by different people who don't communicate with each other. And I think that causes one, kind of segmented, ineffective care, and two, definitely more expensive care. And if healthcare providers would talk to each other a little bit more, I think we'd all do better. So we're trying to kind of improve upon that. If you're injured, we want to see you. Yes, you may need a pain specialist or a chiropractor or a physical therapist or a surgeon, but let's help you navigate that and let's guide you. Like we were talking about a few minutes ago, we can't do it all, but we can certainly help you navigate it, because as much as you think it should be, our health system is not easy to navigate. And so we kind of want to be the center point and guide our patients to make sure nothing goes either bad care or ineffective care or very, very costly, unnecessary care.
Right. You mentioned, your partners and things of that nature. So just a little bit about your practice, like who all do you have there, and what all do you guys specialize in any particular things? Everybody family care? What do you have?
Yeah, so we have there's 4 docs here that in our office in Washington. So myself, Dr. Dave Gus, Dr. Michael Richardson, and Dr. JB Grimes. We have 2 nurse practitioners that work with us, Jenny Gradell and Nikki Larison. And all of the docs were all family medicine trained and board certified. And so we see all ages of patients. Some of us see a little bit younger population, mainly because we're either earlier in our career or newer to the area. Some of our docs see older, but basically we see, 0 to 100 plus, and so we see all comers. And we all have, luckily, a similar kind of approach and mindset, that we want to be, we call it hyper managed, but it's more micromanaged. We want to really be involved in everybody's care and trying to take control of what we can and help people avoid those pitfalls or unnecessary urgent care or ER visits. We all have this mentality of let's try to keep people healthy and out of the hospital type thing. So we're mainly here in Washington. The 4 of us, Dr. Grimes and Jenny, have an office in Warrenton as well. So those are our 2 sister clinics. And we all have our own patient panels, but we do cross-cover each other constantly. So that's also really nice. I think an added benefit for us as providers, but also for patients, that if Dr. Gus is sick, that we're going to see all his patients and treat them just as we would our own patients. And if they need something and somebody's gone. So it's a very collaborative group. It's a small group. And we're trying to make it kind of a, the old time small doctor office feel to it as much as we can in today's system. So,
Yeah. With all the technology advancements that we were talking about before we began.
Exactly.
We have a similar approach here, and I think that it does provide a lot of additional options for patients. So that way, if one of us is sick, it's not like, hey, the office has to shut down, like we're just not here, right? So I love that you guys have your set patients, so you get to know the same person and you're familiar with their care, but in the need that you're not available, that somebody would be there to see them. So I think that is a fabulous thing to be able to offer to patients. Okay, so can you highlight some aspects of your facility that contribute to effective patient care and recovery? Like, do you guys different services that you offer within there, or how does that work for you guys?
Yeah, so I think we're always trying to look at how we can expand that. Most of it is limited by physical space. Meaning we'd love to have more that we could do on site, and right now we're just kind of limited by that. But I mean, obviously we have our normal patient care facilities. We do all our labs and blood work here in office, which is super nice and convenient for patients. And then we do procedures here, so that would be relevant to musculoskeletal medicine. So if somebody needs joint injections or trigger point injections or those sorts of things, we do those in office when appropriate. And the vast majority of the time, those are, all of us are comfortable and trained to do those. And so that's another added benefit. If somebody needs something, they don't have to go see necessarily a specialist if they don't have to. Now, if it's something surgical, obviously that's different. But if it's something that just needs a little touch up, we try to do that in-house. And then we really collaborate with our local physical therapy groups and chiropractic clinics to then stuff that we don't offer because it's not our training. And, then we can branch that out as this is a provider group that we use and trust, and kind of that warm handoff of, it's not our clinic, but it's somebody we trust and we're associated with. And I think that works pretty well, of kind of this close-knit network of support services and other options that our patients and us can all get comfortable with. So,
yeah, I think that's fabulous. Like I said, it's, being able to have that network of people that you do know and trust, that is a level that your patients, I feel like my patients, so I know yours probably are the same, where they just really respect that idea that you see the outside options and you're able to navigate them through those waters. Because I think also the fact that there's procedures you can do within your office. I know the wait time to get into some of these additional specialists, it's just unbelievable. And when people are in such pain, they don't have time to wait for 3 to 4 months to get in as a new patient. Right. So I like the idea that you have that as an option when it's appropriate for a patient, I think is super beneficial.
Yeah.
Okay. Can you discuss the role of lifestyle and prevention measures in managing conditions like knee pain, low back pain, neuropathy? I know we've touched base on some of that a little bit, but do you have any of those lifestyle options that you can kind of guide people for?
Yeah, so I think, whether it's any of those issues you just mentioned, which I know we're focusing on, or whether it's almost anything else that we treat, we can all look at our lifestyle and understand that there's probably improvements to be made. And I kind of approach, you kind of get back to basics of, okay, if you're not feeling well, let's look at, are we eating well? Are we exercising? Are we getting good sleep? These things that I think, anybody we point to who's around could say, well, yeah, I could do better with this and that. And so I think starting there by just saying, I think the basics are really important. Are you getting healthful foods? Are you physically active in some way? And are you getting adequate sleep? I always kind of harp on those 3 things. And then I kind of extrapolate that out. So for people with neuropathy, specifically, a lot of those patients are going to have diabetic issues or blood sugar problems. And so it kind of will tilt that way of how can we improve management of their blood sugar control or diabetes to ensure that this neuropathy doesn't get worse quicker than it would otherwise. So that would be a big thing on lifestyle. For neuropathy, for low back and knees, I usually tend to focus on, okay, are you exercising? And if not, or if you are, what type of exercise, and how can we transition that to a lower impact exercise so that we're not pounding our spine and our knees excessively. And then the flip of that is how do we help manage one's weight? I think I always tell people your knees and your back are load-bearing joints. And so, we need to pay attention to our body weight and where we carry that weight and its impact on our spine and on our hips and in our knees. And so, it doesn't mean we say, oh, just lose a bunch of weight and come back and see us. It's while we're doing these things, how can we support a healthy lifestyle so that once we get you feeling better, we can keep this from getting worse long term. And most of the time, especially if people are getting better with what treatments we're doing, that positively reinforces them to be more active and to make some changes that then can keep these things from coming back. And usually that creates a fair amount of buy-in. You just have to kind of approach it in a way that doesn't seem that we're being dismissive, that this is just a problem because of your weight. Well, no, it's a problem you have that your weight may be making worse. So I kind of take that whole, that whole picture and then focus in on what small changes can we make each visit to improve on that, whether it's diet, whether that's type or amount of activity, or like I said, even is it how you're sleeping? How can we improve on sleep to get you feeling better so you have more energy to exercise, etc. So that's kind of a global view on lifestyle and how I would approach that.
Yeah. Well, frequently it's kind of like a vicious cycle, right? Like something's hurting, and so then they're not as active, and so then they do gain weight. And so I've heard from many patients, that same conversation that gets brought up that maybe didn't go as kindly as the way that you just addressed it. And so I know patients will absolutely appreciate just the way that you approach like a weight type of situation, because it's not a comfortable conversation for any individual, whether it's us delivering it or you're the one who's receiving it. Nobody likes to have that conversation, but it is when it has to. So I think patients will definitely approach the way that you just said that, how you bring that up and how you handle it, because it is a factor and it does need to be discussed. And I just think that, that sympathetic side that I know in you and an ability to be able to patients receive that, I think is going to speak wonders for them. So I think that's great. How do you keep up with the latest research and advancement in primary care as well as sports medicine to ensure your patients are getting the best possible treatments?
Yeah, so a bunch of different ways, I guess we'll say. So I'm fortunate, I suppose we'll call it fortunate, and my wife as well, that we're a household of 2 family doctors. And so there's never a shortage of medical journals or interesting cases over dinner or medical podcasts on road trips. So I think it's really a grab bag of what we do. But typically, obviously, routine reading of medical journals that are published by the Academy of Family Physicians. We're required to do a certain amount of CME each year, just like you are, I'm certain. So there are a lot of times, especially since COVID, very virtual in nature, whether virtual lectures or actual just virtual slide presentations. But we do historically try to go to at least 1 or 2 live conferences where we sit down, have more hands-on with experts in the field. So we both are pretty good about that. I think my wife and I both trained at Mizzou for medical, and I think we both took away that you have to be a lifelong learner to be good in this field. And so it's what ways can we keep up on it and what interests us and what's most relevant to our patients. And the same goes for sports medicine. I usually do try to go to at least 1 sports medicine update per year. Luckily, there typically is one in St. Louis every year at Washington University, so that makes it easy. And then it's just a lot of reading. I think even since I've been out of residency, the amount of good medical literature and material on the internet is incredible, and access to it is pretty easy. And so I think it's as much as I have time to, I try to read and listen and make sure. And some of that's on the fly. So sometimes I realize that, boy, I'm having, Mr. Jones, and he has this issue that I have no idea about. And so then I'm going to go and read all the latest on that. And so sometimes your patients teach you And that's good too. And I usually tell them that, hey, I'm going to go learn about what you have because I'm not sure what to do. And
Yep.
so I think it's just the attitude of we're never going to know it all. And just when we think we learn it, it may very well change. And so I think we owe it to our patients to make sure that we're not getting stuck in older bad habits and that we're constantly trying to get the latest and most evidence-based stuff.
Yeah. I too really love going to like the live event aspect of it because you have breaks, and so you have opportunities to touch base with different colleagues and different things that they've seen or they've been experiencing. And I just think you can grasp so much more, and it just allows you to have that hyper focus when you're there and no distractions. So
Yes.
the convenience of a virtual is really fantastic, but that live opportunity just makes a big difference. And you mentioned like sometimes your patients will kind of help guide you into what you need to be looking at next. And that's kind of how I got started in neuropathy, 100%, right? So
Yeah.
I went to chiropractic school and learned just so many valuable tools to be able to help people. I just didn't really have those skills for neuropathy. And it was a patient who came in who just was an incredible leader in our community. And him and his wife were foster parents, and they had like over 13 kids come through their house, and just great people. And he was like, it was like he came in one day and just the weight of the world on his shoulders. And I thought, you got to do something. Something's got to be different. And so I love that, patients, while we're supposed to be the ones delivering the information to them, that we're all learning from each other in all ways, shape and forms. And I feel like everybody's put into certain people's lives at certain times, and there's a reason why that appointment occurred at that time. And it'll give you that insight to be able to help that next person who comes.
That's right. Yeah.
So yeah, I think that's fabulous. Okay, so let's see. What are some common misconceptions about pain management and musculoskeletal health that you encounter, and how you address them with patients?
Yeah, good. Another good question. So, I think these run the gamut. So I think some people have unrealistic expectations that a chronic musculoskeletal condition is going to get better quickly once they decide to go see somebody for it. So, what do you mean it's going to take 6 weeks of X, Y, or Z? Well, you've had this problem for 2 or 3 years, and just because we haven't done anything for it, we have to kind of start at square one. So I think looking for a quick fix, I don't blame anybody. That's not meant to be judgmental, but I think it's common that people are hurting and they were hopeful for a quick solution. And sometimes we have that, sometimes we don't. But that is definitely a challenge of telling somebody that they may be affected by this treatment for 6, 8, 12 weeks before we see any benefit can sometimes be a real challenge to get people to buy into that treatment, that they may not see that immediate effect. So I think that's kind of one common pitfall that we have to navigate it. And usually it's just how I'd handle that is just being very clear. I think if I tell somebody, for instance, I see concussion kiddos or adults, and I tell them, you are going to miss, 3 games and your tournament, and then we're going to get you better and we're going to get you back, but I can't tell you when that is, versus saying, well, maybe you only miss a week and I'll see you back. I try to be very clear in setting an expectation of what I really think. I don't want to sugarcoat it. I don't want to be gloom and doom, but I try to be realistic in setting expectations of what to expect. Another challenge I think we get is just people's general understanding of chronic musculoskeletal injuries. And so a lot of times we get patients who have a chronic issue. I think it's probably muscle or tendon. It needs to be, rehabbed back or manipulated back or what have you. But, in their mind, they are coming to me and they think an MRI is going to tell them the answer, and then we're going to have a solution. That's a real common discussion we have, that an MRI is not a solution. It is a tool that can be useful, but for chronic issues, sometimes it's not very useful. for acute surgical things and traumatic and severe injuries, absolutely 100%. And even for chronic eventually maybe, but I think, treating the MRI as the holy grail, as I always say, is sometimes a challenging discussion that you just have to educate and explain that those things may or may not be useful, but a lot of times they don't change what we do in the first, 6-8 weeks of treatment. And so not grasping on the imaging too much too early in the treatment course is another common one. And then I think, the flip is that patient that isn't getting better and they're in pain and they're dejected and I don't know what to do. And I'm having to really dig deep as to what I think is the appropriate treatment. And
Mm-hmm.
patients are throwing in the towel or wanting to, and how do we engage with them and help them, and not have them just kind of give up and assume that we can't help them. And that's usually where kind of that multidisciplinary approach is what else can we pull from that we're not doing? Is that another specialty? Is that a chiropractic addition? Is that a physical therapist? What else can we add to this regimen because what we're doing isn't working? So there's definitely a lot of challenges in chronic pain. That's no doubt. So
Yeah, absolutely. But we frequently, patients who have had this, I've had this issue for 6 months, 10 years, just a wide variety. And so it is a common conversation we have to have as well. Like, I can adjust you one time, but I'm not a miracle worker, and
right.
dealt with this for years now. It's not going to just one adjustment and you're going to be ready to go. Definitely, hopefully, a reduction in pain, but that doesn't necessarily mean that you're completely better either, and it potentially will come back. So trying to look at that from how do we make sure that we look at this and you don't have these current re-episodes of nonstop discomfort. Like, that's not fun for anybody, and I don't want any of that. So, if you don't mind, would you mind telling us about your own personal experience with chiropractic care?
Yeah. So absolutely, I'm happy to, and I share this with patients fairly regularly. So I had kind of mysterious onset of what became chronic neck pain. That was kind of at the base of my neck into my periscapular, around my shoulder blade area, without really an inciting injury. And it kind of just snuck up on me, and noticed I was more sore than I had ever been. And then, my wife kind of pointed out at some point that I wasn't sleeping well, and I kind of recognized that, man, whatever this is really is keeping me up. It was making me very frustrated, and so it was almost like fortuitous that I was like thrust into the role of the patient with chronic pain, which fortunately I haven't had to deal with, but immediately, and I wasn't in severe pain, so I don't want to make it seem like poor me, but and I told my wife, and as soon as this happened, I said, boy, I don't know how my patients handle these chronic painful conditions, because this is very annoying and it's frustrating, and I'm not in a good mood, and I'm unhappy and I'm angry. And so immediately I was on the other side and understood a lot more of what we see. And as my wife would like to say, I like to complain, but then I won't do things to make myself better. So, I was just dealing with it and not changing anything. I don't like taking medicine, so I didn't want to take anything. But so finally, I started kind of saying, okay, I need to approach this of what I would tell myself if I were the patient. And first thing I did before I did anything else was try to fix my workplace ergonomics, was trying to fix what I perceived I was doing in terms of, was my neck alignment correct? Was my computer monitor at a good height? What things can I do there? I adjusted how I was sleeping, so some of those basic things. And as I started kind of interacting with patients more that were having similar things, that's where I kind of recognized that a lot of my patients who had chronic pain at some point or another had been to a chiropractor or had that as a part of their ongoing care. And so a mutual patient of ours, I think, is who introduced me to you all just out. kind of in passing. And so I said, well, you know what, I'm going to go try this out. And that's when I met you, and told you my story, and kind of you helped me kind of take what I was already doing and add in this next layer of periodic adjustments of my back and neck. And between that, the lifestyle changes in a little bit of time, then to now where I don't have issues with that, very minor issues. And so, that's like a good success story. But it's also kind of taught me that there's a lot to say for periodic maintenance for these types of things where I can tell when I go a month and I haven't been paying attention to my posture, and I haven't been paying attention to scheduling my adjustments and things like that so I recognize that these things can be part of an ongoing maintenance program. And again, it's not for every single type of injury and issue, but for me, it was very effective and remains effective. And so it allowed me to understand what you do better, to directly see the impact of that. And also that helps, I think, patients comfort if I recommend something when I tell them, here's what I did for my exact problem that you're having. And that makes it very easy to help those patients who have a similar problem. So I had a very positive experience, and it's been great. So.
Well, I love that. Thank you so much for sharing it, for sure. One final question for you.
Sure.
What do you enjoy most about working in family medicine, specifically in the realm of musculoskeletal care?
Yeah, I think most of us family docs, if you ask this question, I think the variety in what we do is what drives us and why we chose what we did. That we get to be, kind of a poor phrase, but a jack of all trades and a master of none. But that there's not really a problem that we can't at least start to handle. We see everything that comes through the door, and we need to be equipped for that. And that makes it very unpredictable and at times very, very challenging, but also rewarding in that there is a variety in my day. And you're not sure what's going to happen next. So I think, specifically with family medicine, that's what I like about it. It's what I've always liked about it. Knowing that I can help somebody with just about anything that comes in. And with sports medicine or musculoskeletal care, I think that helps us kind of have a subset of knowledge that helps a very large patient population that can't all go and see the foremost expert orthopedist because there's not enough of them. And so how do we help them approach this and navigate this problem that is very, very common? And so I think it's rewarding to be able to offer people individualized treatment plans for their issues to help them be more effective or happy at work or in their sports or in their activities. So I think it's rewarding, especially when your patients get better with pain and musculoskeletal issues, is seeing that dramatic change in even their demeanor or their personality when they're not so saddled with a debilitating injury or amount of pain. So
yeah, that's fantastic. And that's why you're such a great physician and why your patients absolutely love you. So if you wouldn't mind, can you give a little bit like how to contact your practice, where you guys specifically are located, all of that kind of good stuff?
Yeah. So we're at, our parent company is through ESSA Health. It's ESSE. A lot of people are like, what the heck is that? After working with them for about a year, I found out that ESSA is Latin for well or wellness. And so the kind of motto is, we want you well. But the idea being, we want to keep you healthy, not just treat problems as they come. But our main office is in Washington. We're right at the intersection of Highway 100 and South Point Road, just as you come into town. And our local office is dubbed Phoenix Family Medicine. So that's how you can find us online, or you can Google any of our names. And and you'll find the ESSA Health website for our specific office, or for Dr. Grimes and Jenny in Warrenton, that'll be there too. That's Phoenix North, so that's our north office.
Okay.
So online, you can do that, and you can get our direct number that you can call if you would like to see us or learn more about us. We're happy to provide that information. So
yeah, we have a lot of similar patients, and I, from personal conversations with them, they all speak just so highly of your entire practice, and so I really appreciate everything you're doing for our community and for patients, and just that you're constantly looking out for them, and that's a feeling that patients, definitely state to me also. So I absolutely think that you guys are doing a fabulous job, and I appreciate your time this evening and hanging out and getting to kind of know you and how you guys function and how we can all work together better. And so thank you guys. Thanks for everybody who tuned in, and we'll catch base with you later. Have a great evening. Thanks.
all right, thank you all. Appreciate it.